Dr. Rolla and the rest of the moderators. Thank you very much for joining us today, and it's an honor to be part of this event. And also I would like to thank the previous speakers because they covered most of the things, so I will be shortening my presentation to keep in with the program. So if I can have my first slides on the talk, please, on the show. So running a simulation center during COVID, actually it was a great opportunity for simulation education nationally and internationally to showcase the outcome. This is King Abdulaziz University where I work and will be presenting most of the work. This is the hospital where my daily living is, and I'm working with a great team of anesthesia critical care department who is a big support. And of course, this is part of what the society do here, advancing simulation practices together in this and other with cooperation with the Ministry of Health. And I hope the coming 2 days, today and tomorrow, will bring a lot of activities and collaboration and networking like others. As I said before, many of the speakers today covered the practical aspects that I was trying to cover. So I will be more moving to secondary objectives, how to use principles of learning to integrate simulation at a large part for previous crises or any other situations or new surfaces, and how to enhance engagement with audience and with organizational needs in simulation. Simulation is not different than any other leading industries like engineering. We always plan, do, check, and act, and go back. And this is the way that people go to space and come back, is to have these experiments, always planning, doing, checking, and acting. And this is what is simulation, to prepare individual organizations. And this is how we get back. So why simulation? A lot of reasons, and the uses and the future for this. So we know that adults learn with there is a problem, there is immediate need to solve problems, and that's why simulation, if you tailor it well to the problem like the COVID-19, people will be prepared either in situ or in the simulation center. Of course, simulation has been used widely to prepare for COVID emergencies everywhere, and the experience started from China to Europe to America to us, and we gain advantage by having everybody grow this cycle of work as imagined and work as done, and then going back and forth on these rotations in order to implement simulation from being a concept, new guidelines, to real life. In our hospital, at our center, as many other centers, we start planning. We had an active engagement from all departments. We're doing in situ, and in the simulation center exercises, a lot of debriefing, lots of people worked on this, and then developing protocols to implement this and bring safety to the, and we used a lot of the valid check forms or frameworks for micro check, debriefing, briefing, hurdle, and going through these cycles. And the system introduced by the Harvard group, the SMS, talking about how you could do the same techniques during any shift or any simulation crisis or any future crisis. This is what we used during the last few months or during the last year with the crisis. And of course, as colleagues from Crescent and other centers, it is very highly effective to safeguard against institutional infections by having effective training. And our data coincides with the early data from UK that if you train people, you save the healthcare worker. Actually, most of the infection at healthcare institutions happen in the back sides of the hospital where COVID patients are not coming, training was not focused, and that have led the importance of so of course during COVID, simulation was used to test new systems, and this is the studies from Crescent, how did they use, and they published their experience in preparing organizational changes, implementing and spreading the fact that these useful tools could be shared from one institution to another. And that has been a great example of the progresses that we've done in Saudi Arabia in bringing simulation. Of course, this has been done at many experimental models, how to save against aerosolization and infection, how we test new systems, new equipments, new ideas during COVID. This is all has been covered using simulation. Of course, if we need more ventilators than we don't have. Of course, that has been also tested by simulation, simulating how we could use. Of course, alhamdulillah, I think not here or many other countries, we never needed to use one ventilator to more than one patient, but simulation has been used to prepare even for the eventuality that we have that crisis. Again, different types of interventions and treatments. And of course, this has been done like in Saudi Arabia, like in other places, in Canada, Europe, and also in Saudi Arabia, we publish our international experience in using simulation for critical care, and this has been published recently. Of course, if you want the guidelines from the Saudi Society of Simulation Healthcare, led by the scientific committee, led by Dr. Taqwa Omar and her team, published the guidelines for the roadmap for using and operating simulation center from the planning through running till exiting, and these are all available in our website, and it's very useful guide for during the COVID, now and in the future, because the world is different. We will not be back to pre-COVID areas. Again, I'll be just some of our experiences at our simulation center from King Abdulaziz University. As you know, our simulation center has been one of, we are 40 plus great team who are doing a lot of these works, supported by the hospital. This is our vision, mission, and goals for the simulation center at King Abdulaziz University, and the center has been accredited by Royal College of Canada, American Society of Simulation, and we got the Emmy Award for Excellence in Simulation Education. That all helped us to prepare for this upcoming epidemic. We started very active planning, as many other centers, to prepare the hospital, the institution, the university, and maybe other centers to prepare. We've had a lot of energy going into this. It was a tough time, but we had a lot of support. Those are the courses that we've conducted over the first 6 months of the epidemic. 147 BBE course, 8 activities for 5C, as Dr. Amira explained, and difficult airway. We've had over 100 trainers training more than 5,000 hours. Those are the numbers of the trainees from the start from March till September 2007. Even the cleaners of the hospital, everybody in the university was trained. Of course, the program went through a rigorous process of setting up and running, and we spared nobody at the institution in terms of the training. And we went through the current cycle for development, deployment, and running the courses. These are the BBE courses, as I said, 2,500 people in 83 days were trained. Also, we implemented the National COVID Crisis Crash Course for non-critical care, and we run courses to train over 100 people using the same strategy that Dr. Amira Clinton covered during her presentation, and we managed to train 100 people in 8 days to increase the critical care capacity at our institution. Of course, we also developed virtual and on-site 2-hour hand-on simulation course to supplement difficult airway management. Also, we managed to train 70 people in 4 days for difficult airway and airway management at our institution. Together with that, we've had a very active social media presence to spread the fact and raise hope and prepare other centers to follow suit, and that has been very effective. Of course, to summarize, lesson learned in preparing for COVID, it's very well known that this is, I think, the model for the future. Pre-COVID, there were a lot of educational protocols. But during COVID, there were a lot of testing. I think the future for COVID, for training is to just to go up, because everybody recognized, as you could see during this event, during many others, simulation has been more integrated, and you cannot train people, teams, and individuals and institutions without having heavy and instrumental investment to simulation. Of course, the World Health Organization have introduced a lot of resources in its website, and it's available in all languages for simulation-based training, and it's available in their website for references. And of course, you could train everybody on-site, off-site, using even laparoscopic training. These are experiments are now very well spread, like even laparoscopic surgery. You could train people abroad or in other countries or other locations using effective techniques of telesimulation. And my next speaker will be talking about the experience from Morocco, and other speakers will be talking from Oman. This is reinforcing that this is doable. It doesn't matter where, Taiwan or Saudi Arabia, Morocco or Oman, you could always do this, and this is very effective. So challenges for remote training is always, people will tune out. How to get people focused with you when you do telesimulation, distance simulation, or of course you have to describe the program, provide good material, good follow-up before, during, and after. So it needs a lot of training and a lot of practice from us educators, administrators, and simulationists to prepare for this. Of course, you have to have follow-up, like having people videotape themselves, feedback, evaluation, testing. As Dr. Amira said, you just can't assume people will understand everything. So you have to follow your simulation activities, especially distance simulation, by some sort of testing or reconfirmation of competence of the recipients. Of course, you have to have post-course material and follow-up for feedback, and also if you could also do later assessment to test the system. Like in our hospital, we do some tests before, then do the simulation, and then we test the system again with other instruments or another drills to make sure that people got. So running simulation during COVID and after COVID is very great opportunity to advance the use of simulation. How to develop practical tools. I think now in Saudi and many other countries, we do have the resources. We just need to work together with our clinicians and our departments and our administration at the hospitals, how to integrate this. Simulation, because it solves people problem of competence or need to be competent, it always works better if there is a need. And COVID and post-COVID era, there's a lot for needs for training that you cannot do in real life. Again, the guidelines from the Saudi Society of Health Simulation and other organizations are great asset to develop these science. And I would like to thank you, and sorry for being short, just to keep with the program, and I'm sure it will be covered and we could have. Thanks again for my great Department of Anesthesia at King Abdulaziz University for their outstanding support for our activities and for our simulation program and staff at King Abdulaziz University Clinical Skill and Simulation Center. Thank you very much. And for the society members who always been there for this event and others, and we would like to see all of you during this assembly and maybe other assemblies to having more activities and more of your successes shared on this platform and others. Thank you very much.